Welcome to The Remedy, brought to you by NYC Health and Hospitals, innovating public health care to benefit all New Yorkers.
Hey everyone, it's Dr. Michael Shen. Today, we're coming to you from a truly unique location. It's at the heart of our city's response to a humanitarian crisis, and some have even called it a modern-day Ellis Island. Today, we're at New York City's Arrival Center, located at the Roosevelt Hotel in Midtown Manhattan. The Arrival Center is the city's main intake center for newly arriving asylum seekers. Here, individuals and families receive medical care and social support, as well as routes to temporary shelter, housing, work, and reconnection to family members within or beyond New York. The numbers are staggering. Since its opening in May of 2023, the Arrival Center has welcomed nearly 180,000 asylum seekers from over 160 countries, assisting all of them, from children to families to pregnant women, in getting the care and support necessary to continue their journeys. Joining me today are two incredible people who are at the center of this work: Shen Hanlon, director of the Arrival Center, and Besa Rexha, deputy director of the Arrival Center. Today, they'll be taking us inside the Arrival Center to hear how it has changed thousands of lives, discuss new challenges, and learn about the role of NYC Health and Hospitals in this enormous citywide effort. Shen and Besa, welcome to the show. Thanks for joining us today.
Thank you for having us.
Shen, you've been here at the Arrival Center directing a lot of its work for a while now. And I wanted you to tell me a little bit about its origins and why it was created, and what are the challenges that it hopes to solve?
Thank you for the question. The Arrival Center began in the spring of 2023 in response to the influx of asylum seekers. As you mentioned, specifically, one of the main groups we were responding to was the asylum seekers who were being bused and flown into New York from Texas. So it was set up to be a one-stop shop to support those new New Yorkers, providing medical support, social work support, behavioral health support, and shelter for those individuals and their families. And that is what we have done 7 days a week, 24 hours a day since then.
That sounds like really incredibly hard work to navigate.
Yes, it's been hard. 24/7 operations at the end is a job that, we walk away with great impact in people.
So, we're recording this on site at the Arrival Center, and walking in, I've heard about this place so much from my patients, and just walking in was kind of mind-blowing for me. And, I see that, and you can hear in the background all the construction. This is right in the center of the city, right in Midtown. I can't imagine what it's like to arrive here. Besa, can you describe what happens when somebody walks through those doors?
Sure, absolutely. So at the entrance where you entered, so this is where the families and adults come through. They get greeted. So after there, we have a process in place where we go through depending on the needs of the families, individuals, which defines based on shelter seeking or services. So from there, depending on the needs, we do make sure that families and all our guests are comfortable. We provide space to leave their luggage. We provide space of, meeting with our behavioral health prior to proceeding, which is legal resource navigator, which will go over legal services or any other services that they may need. We also make sure that they are nourished while they're here prior to going through the process, which takes a registration, medical triage, and afterwards the placement.
Sounds complicated.
We've been here for over 2 years now, and it's been great. We have everything in place, great teams that have put a lot of process in place within the policies and workflows. So it's been great.
And it's always changing based on the evolving needs of the guests who are coming through the door. So in the beginning, it was all newly arriving families and adults families. And then over time, we've gotten more returning ones. So people have been in shelter stays for a period of time and are now coming back for a new placement. So now it's a mixed group of both of those, whereas originally it was just the new arrivals.
Gotcha. And, just seeing the staggering number of countries that these new New Yorkers represent, I think, I'm sure that all of their different needs are also very, different, varied, and you guys have to kind of be able to triage a lot of that. and address a lot of those complex and varied needs. One of them being, healthcare. So Shane, I know that the medical area here is sometimes known as the beating heart of the Arrival Center. Can you tell us a little bit about the services that are provided there?
Absolutely. I mean, for many, this can be the first medical intervention throughout their entire journey. So this could be when they left their country of origin through the long journey to get to the U.S. after even crossing the border, then being put on a bus to sent to New York. And this will be their first opportunity to have a screening for any communicable disease, to have a behavioral health screening for any urgent mental health needs, and to be offered vaccines. For example, we've offered over 80,000 vaccinations at our Arrival Center and at our health and hospital shelter sites. Those are the HERCs. And if we consider the H&H hospitals, that number goes up to 150,000 vaccinations offered for our New Yorkers. So it's massive support that I'm proud to be a part of. We're also doing screenings, for example, TB right here on site. So we can do x-rays here for guests who need that service.
Oh, you can do x-rays on site here?
Yes.
Wow. That's pretty incredible. I know coming from our hospital in Brooklyn, obviously screening for tuberculosis is a huge public health measure that you guys are taking. And I know that has a huge impact on the health of the city. I think, in thinking about all of the other kind of routes that you were mentioning earlier, Besa, that you're helping guide people towards, I know that one of them is also reconnecting people with family members in the U.S. Can you tell me a little bit about that process and how that goes?
Yeah, sure. So when guests come to Arrival Center, part of the process is reconnection, where we engage with the guests in terms of having family members here or having friends that, that can open their doors and support them while they're, getting themselves settled here and, aiming their goals and their dreams here. If they have a reconnection, if it's successful and they have a family or friends that's willing to accept them, we have approximately, I would say, a quarter of our guests. They do leave Arrival Center within 24 hours.
Oh, wow!
So it's pretty quick.
Yep.
And this could be local, tri-state, national, or international. If they do, yes.
Oh, wow! And they're going to family members that are here, or there's
could be family, it could be friends, it could be a work opportunity.
Oh, I see. Okay.
Shelter opportunity. So we wouldn't send them to actually like a shelter, but like a housing opportunity they might have. And then I would also add that even if they are, maybe they didn't intend to come to this site specifically, but they came and then we offered them this service and they left within 24 hours, we're still offering everyone the essential medical and behavioral health screening services and vaccination services for all those guests.
And Shane, what kind of follow-up and case management do asylum seekers get when they leave the Arrival Center?
Well, we provide the three areas I would mention are legal, workforce, and resettlement support. So legal relates to the status that can allow them to live an independent lifestyle. For example, work authorization. Within the 800,000 exit planning meetings that have been performed, more or less, 80% of eligible adults have received or applied for work authorization. So that's just one example, but we also have asylum status and other legal supports which are provided to them. Also, workforce support is provided, so possible employments for them based on their background. One example which comes to mind is we had one of our team members were visiting a site and a woman came up to them who turned out to be a security guard there and said, "Do you remember me? Because you actually helped me when I first arrived here at the, Arrival Center."
Wow.
So, they had, because of the workforce support provided to them by our exit planning teams, they were able to now be working as a security guard at one of our sites. And then the last point I would mention for continued case management support is resettlement. They're helping folks understand how to get housing, if you're talking about New York specifically or elsewhere. But, how do you find an apartment in New York? What's the process like? What are the documents you need to get an apartment to live independently in New York? Because as we all know, that can be quite a difficult process.
The other thing, that just kind of blows my mind is, how long do people travel for that you've seen? Months?
Yes.
Weeks, months, definitely a long journey that they take through forests, through rivers to get here. Very tiring journey.
Yeah.
Just people tell stories of being held, in jails, for example, for periods of time, extorted during their journey. People will arrive with very few belongings, and perhaps they left home with many more than that, but they lose them along the way, and they come here, and we have clothing and hygiene kits, and as Besa said, food just for that purpose, so that immediately at least those basic needs can be met, because some of them, those journeys have been very difficult.
And, besides the kind of like urgent physical injury that you might have to attend to, the emotional trauma of that is, I can't really even imagine. I've heard a lot of stories from my patients as well that honestly, they just blow my mind. I don't know how people have the kind of like the strength to endure that. It's really amazing.
You do hear different stories. When you think this one is worse, the next one can be worse, right? That people go through. So at Arrival Center, we do focus on health and making sure that our guests are healthy. If they are in need of, any vaccination and stuff, we're going towards there, of course. And we also do the depression screening, right? Knowing that these, our guests have gone through a lot to get here. It does have a toll or impact in mental health. So part of the medical triage, every guest 12 years or older, we do PHQ-2, which is depression assessment. And from there, depending on the score, if it's high, then they will meet with our social worker, where they will be further assessed and do a PHQ-9. And depending from there, we immediately, connect them with medical provider, with virtual clinics, with mental health clinics, or if it's an immediate need, definitely the emergency room. So afterward, as they receive the placement, this care is continued. So they are finding the support at arrival, but it continues post-arrival center. And it is a continuous support that they are receiving and making sure they are healthy.
Yep. And of course, while they're having their initial conversation with a medical specialist here, they're told about all the NYC Health and Hospitals facilities around the city where they can get continued care. So that's a great bridge that we're able to make immediately. Sure. It's not just while you're here. We give them documents which give them the addresses, locations, and services offered at all the NYC Health and Hospitals locations, and explain to them that they can go there for help.
And it's been a great relationship with the hospitals as well. So when someone goes there for a visit, we stay in connection when the hospitals will call us back to make sure that the guests are safely back at Arrival Center to continue their process and, either shelter or other services that are here.
In addition to kind of all of the needs that you screen people for that you were telling me about earlier, I know that there's some unique needs that people come in with. I was talking to Dr. Natalie Davis in the last season of the podcast, who's one of our obstetricians in our system, and she was telling me about the pregnant patients that have come to Bellevue to deliver their babies directly from the Arrival Center. What's that like?
So yes, we have had guests that were actually in labor going through the medical triage or close to their due date. Guests that have never gone through their checks, making sure they were healthy or the baby was healthy. They knew that they're expecting the baby roughly, due date based on their own estimate. So yes, from there, we send them mostly to Bellevue. They go for delivery. And the connection between Arrival and Bellevue and the rest of the hospitals has been extremely helpful. And we do stay in close connection. And after delivery, to make sure that the mom and the baby, they come back, finishing the process and go into a placement.
Yeah, and I assume also connecting them to prenatal care that
yes,
they would have had otherwise.
Absolutely, yes.
And Shen, I think even There was a story about a baby being born on site. Is that real?
Yeah. We've had a few of those instances across all our sites. But there
A few.
yes.
Oh, wow.
But I could speak to Arrival Center specifically. I know of at least one case where there was expecting mother who, after the journey, when they were in the Arrival Center, actually went into active labor. And I can only assume it's because their oxytocin was released because they were finally in a safe environment. That perhaps when they were crossing the border, when they were on the bus coming here, wasn't quite as
well. I'm a primary
comfortable.
Care doctor. I'm not an obstetrician, so I've long forgotten those terms.
Yeah.
But, I'm just joking, but I mean that sounds it sounds really amazing. I think it gives a different. It gives you a different idea about what Arrival Center means, I think.
Oh, yeah.
About the babies born. Speaking of like just incredible stories, I'm sure that you guys have seen a lot and you've met a lot of people. I was wondering if there were any other people who have stuck out to you over the time that you've been working here that you might want to tell us about.
One that comes to mind is it was a family of 5, 2 parents, 3 kids, and came from Ecuador. And when they came through the Arrival Center, they were speaking with one of our managers, and they were, telling them about their story. As I've experienced, like, many people are very open. Once you bridge the gap and start talking to them, they'll tell you about where they came from, their background, and also what they're looking to do. And they explained, our main thing we're looking for is just to get independent, get work, and settle here. And this manager happened to know that someone who was starting up a business, and they communicated with them, and they made the connection. It started out with the father in the family working for this business, and then the mother joined. And to this day, they're both employed there. They're also living independent now. They've got their own apartment in the Bronx. And apparently, for what the business owner told us is that for like the first 6 months, almost every day when they started their work, they would say like, gracias por like health and hospitals, gracias por Arrival Center. They were just like, so every day they would express some gratitude for the support that they got right away. That's one that comes to mind. I don't know about you, Besa.
So during the busy times last year, we've had a lot of guests in the lobby. We have our elevators were in the same space as Arrival that go to Roosevelt floors, right? Where we have our Roosevelt guests. So during that time, it did pull my attention. A parent with a child that it would come to the elevator and is dragging the kid and putting behind the back and just going into the elevator. And I'm like, okay, so wanted to look into it and understand that behavior a little bit more. So while I was looking into it, the parent and the child came themselves down to our team requesting, something from the team. So during that interaction, right, so I see the child behind the father, So I peek in the side and I'm like, hi, you're such a beautiful girl. And she sees and she goes and hides back. So then the father explained the story, very terrifying and, went through a lot. It's a family from the islands. Their home was set on fire, where unfortunately both their kids, were inside. So that tragedy, it did leave marks on the face, on the body, and the kids went through a lot. They got bullied at school.
Mm.
And, so I'm talking to the girl and I'm like, you're an angel, you're beautiful. And the father goes, she doesn't understand you, and she can't hear you. All of a sudden, this kid comes out and just puts both her hands around my neck. And I'm like, we can connect with people even if we don't speak the language, right? That could be body language. That could be the soul itself. And I asked the father, I was like, I wanted to make sure. And one of my main things with that family is that I want you to feel comfortable here. You are welcome. Everyone is the same and treated equally. And I want to make sure that you are receiving all the support that we have here and anything that we can in our power, right? Of course, with his permission, I did follow-ups with the family for a couple of weeks. Wanted to make sure that they were settled down, they were feeling good. And just to hear the word thank you from the parents, both of them, not just to me, but also to the program, to the people that work here, that we welcomed them with open arms, and their kids felt good. And they met people that saw their kids in the family just like every regular family. And that meant the world. We can make a difference here in different ways. And small gestures, I've seen it. It goes the long run.
Thank you for that story. Thanks for telling me your stories. Speaking of kind of the services that families with children can get, I know that we also, take it upon ourselves to enroll a lot of children in schools, right? Is that correct?
Absolutely, yeah. We have the Department of Education both here and across our health and hospital sites, always working to both enroll kids in school and also, if there's a change to where they're living, they can change where they're change the schooling for the child to save that administrative burden for the family and make sure they have continued education.
And so your story was also kind of just, you mentioned the power of nonverbal communication. There's so many different languages that you encounter every day, I'm sure. How do you go about communicating with people from different countries with, different dialects and all of these languages?
We do have over 90% of our workforce, they're bilingual. So that has been tremendously helpful. We also use the language line that has over 250 languages, and also in different dialects, right? You can have the same language in different dialects, and that is also available. And it is a live stream where they can help, translate in lifetime.
And it can also support nonverbal guests as well.
With like a sign language?
Yes, sign language. It's part of it.
You can call them up on video.
And what do you wish people could understand about the work that's being done here and the impact it has on both asylum seekers and the broader New York City community?
So I do have a personal experience where I do come from an asylum seeker family, where my family migrated from Eastern Europe to England, from England to New York City, where I have been settled and aiming my American dream for almost 18 years. So I definitely can be in any asylum seeker's shoes because I know the struggles that my family went through. I know what my parents went through, being away from family, not being able to be there in good or bad times, financially. So it does play a big toll in a lot of motions in terms of the family. So it's good that we have these support here, right? That we are given to our guests, right? To be able to be independent, right? So it's good to know your rights, right? Especially living in the state, right? Or the city. It's good to know, the options for health insurance, making sure everyone is, healthy, and or safety or shelter that helps you until you are becoming independent, right? Part of that is, applying for asylum, applying for work authorization, connecting with work, going to learning the language. So it does play a big factor that, eventually everyone blends in and we work with these families to make sure that they are part of the community, I was once in their shoes. Now I understand. Maybe someone else will be, in my shoes or these guys' shoes that understands. And New York City is the apple of diversity where everyone is treated equally. Wherever you go, you're treated with smile and you don't see any difference. So it blends in as one family.
Yeah, absolutely. Where I live currently, it's across the street from the Cabrini Shrine. So that's the shrine to it's in Washington Heights, and it's actually the patron saint of immigrants. And that's in New York. That's in New York City. And so that reminds me also why this is, as we all know, this is a city of immigrants. And yes, this was a big influx, but in the end, this is what, as Besa said, I mean, this is what we are. This is what makes us great, our diversity. And so I'm happy to be supporting this piece of it, but also the larger aspect of all New York City institutions, which NYC Health and Hospitals is a key actor in, that gives this foundation for people to get started with, to get their basic needs in this city.
I think you've brought me through a lot of your work, which seems, I can't really imagine what it's been like to be here at this hotel and run the Arrival Center at the heart of, this movement, this response. I always ask people this at the end of the podcast, which is, you must hear so many, stressful, traumatic stories. You must see a lot during the day, have to make a lot of kind of really urgent or maybe even life and death decisions. And that's a lot for you emotionally, I'm sure. What would you say helps you get through that day to day? What brings you joy in your work?
What brings me joy at work here is knowing that we are making a difference in families, making a difference in adults, providing services, and making sure that who comes in our doors are leaving with hope, leaving with services, knowing their next steps, knowing their rights here. So even though the work might be a lot, that kind of pays itself at the end when we know that people are leaving with a smile when they walk out of our doors.
Absolutely. And I also feel like it's remembering the core reason that I'm here and remaining connected to those individuals. So, yeah, like you said earlier, the operations are massive and they don't stop. But anytime I'm getting overwhelmed, I walk out on the floor and I connect with an individual family and I slow everything down and I have a conversation with them. And then that brings me back and makes me present in why I'm here, and it re-energizes me.
Amazing. Shane, Besa, it was really wonderful to talk to you. That's all the time that we have today, and I just want to say a huge thank you to both of you, Shane Hanlon and Besa Rexha, for giving us an inside look at the essential work that's being done here at the New York City Arrival Center. And thank you for listening. Don't forget to subscribe and leave a review wherever you get your podcasts. I'm Dr. Michael Shen, and this has been The Remedy, brought to you by NYC Health and Hospitals. See you next time.
This podcast was produced in partnership with Amaze Media Labs.